Don. So looking at the numbers this week, we remain hopeful as our cases continue to drop. Unfortunately, it's not at the rate that we've seen over the last 2 weeks where we had over 1,000 case drop, but we're heading in the right direction. I do want to point out that we're still a community of high transmission, meaning that we're well above the 100 cases per 100,000 rate. We're hovering around 350 per 100,000. So that's still very concerning. I want to get that message out there. Again, we're hopeful, we're heading in the right direction, but we still need to remain vigilant. Our community is still seeing a high rate of disease at this time. We got a long way to go. Just to give a little perspective on those numbers, at the beginning of June, we were looking at about 30 cases a day. Right now, we're still around that 300 range. So again, there's still a lot of it out there. So I encourage folks to use those common sense measures, masking in public indoor settings, social distancing. Please continue to seek vaccination if you have not been vaccinated already. Looking at vaccinations, unfortunately, on that front, we've seen a significant drop in the number of folks receiving their first shot from week to week. In mid-August, we were looking at over 1,000 each day. Right now, we're down to about 275 first dose vaccines daily. Looking at age groups, particularly school age kids, right now they're at 42% for 12 to 14-year-olds for vaccination. 5 to 19-year-olds, you're looking at 49%. As a community, we're 59% vaccinated. Looking at the age eligible population for vaccination, that puts us at 66% of those eligible by age to receive a vaccine. Our health department is, of course, still offering vaccinations of all the available COVID vaccines. That's weekdays, Monday through Friday, 8 to 4. We are also doing testing. That's Monday through Friday, 8 to 6. You can certainly go to our website, brevard.floridahealth.gov, and all that information's on there. I know there's a lot of discussion about the booster dose. So today, the FDA is meeting all day. Those recommendations will be brought to the CDC, and I believe they are meeting midweek next week. So we'll see what the guidance looks like from the CDC, and we'll certainly have more information on that as it becomes available. As it stands today, we are giving the additional dose to those that are eligible to receive it. Per recommendations, that would be folks that are under treatment for cancer, on immunosuppressive medication, recent organ transplant, high-dose corticosteroids, and some kind of immune deficiency disorder. Those folks can seek the additional vaccine at this time. But for the general public, we are not providing booster doses. Again, we are waiting final recommendations from the CDC on that. And that's about all I have right now.
Thank you, John. And just for a point of clarification, you said that in June we were seeing 30 cases a day, and then I think you jumped to 300. I'm not sure what you were saying there, but how many cases a day now are we seeing?
Right around that range, 300.
A day? Okay, all right. I will now turn it over to our Emergency Management Director, John Scott, for an update. John?
Thanks, Don, and good morning, everyone. Again, my name is John Scott. I am the Emergency Management Director for Brevard County. I just want to hit a couple of things, sort of building off of what John talked about with where we are numbers-wise. I think one of the things to point out to everyone is, in looking back at sort of where we've been with this Delta surge and where we are overall, it's important to note that since July, we've seen about 43% of our total cases just with this Delta surge. So, slightly under half of our total cases so far have come with this Delta surge in the last 3 months. So that's significant, and that really should reinforce the idea that we're still seeing a high rate of transmission in our community. And those numbers that, John just talked about, again, represent numbers that are still higher than our previous peaks. So while we like the sort of the trend downward in cases, we are far from out of the woods on any of those things. And vaccinations, like we've been saying every week here, remain our best way out of this. The more folks we get vaccinated, the higher the protection level is in our community, the more we're doing to safeguard our most vulnerable residents and those folks who can't get vaccinated, like children or those with medical conditions. So again, it is on us as a community to protect our neighbors. Talk a little bit about testing. We have opened additional 4 sites. We did that last week, over the last week and a half. I just want to again highlight what some of those are and where they are. There's Parish Medical Center in the north. They're doing testing 7 days a week, 8 to 6. That is appointment only. You can go to their website. You can go to our website to find that information. There's Kiwanis Park in Merritt Island, which is a drive-through testing. Parish is also a drive-through testing. Kiwanis Park is 7 days a week, 9 to 5. No appointment necessary, but they are encouraged. As John mentioned, they're doing testing at the Department of Health, 8 to 6, Monday through Friday. Again, appointments through them. And then at West Melbourne Community Park, which is right next to Field of Dreams Park, off Minton Road in West Melbourne. That is a walk-up site. That is 7 days a week, 9 to 5, and we encourage appointments there. In addition to that, we have seen the demand for testing go down in the last week or so. We also know that pharmacies are beginning to have same-day appointments, certainly appointments in the next 24 to 48 hours, those kinds of things. Same at urgent care centers, same at doctor's office. So we are seeing tremendous relief in the demand that we need for testing as we continue to try to make it more and more available. But like with all things, demand is going to drive availability. I also want to talk a little bit about the monoclonal site. That continues to be available for anyone who is looking for a COVID treatment. So if you're COVID symptomatic, you're COVID positive, or you've been exposed in a close contact to someone who has COVID and you're looking to get a treatment, that is available Monday through Sunday, 7 days a week, 9 to 5 at Kiwanis Park. Again, appointments are preferred, but walk-ups are also accepted. Again, just as a reminder, that is those are 4 shots, 1 in each arm and then 2 in the stomach. And then afterwards, you'll be observed for an hour. So again, we like to remind people to, if they're going to go for the monoclonal treatment, do it earlier in your symptomatic process. Don't hesitate. Don't wait. Just go. You don't need a doctor's note. You don't need a referral. And then prepare to be there for a little bit. I'm going to be there, again, observe for at least an hour. Process takes, upwards of 30 minutes. So hour and a half to 2 hours to get through the whole thing. And make sure you eat something. Make sure you're staying well hydrated. All of those things are going to help you receive the treatment better. So those are the options that continue to be out there. Again, just want to hit the importance of being vaccinated, what that does for us as a community. And if you are someone who is symptomatic, if you are someone who's not feeling well, don't take the chance to try to figure out, 2-3 days. Is it allergies? Is it just a cold? Increase your preventive measures. Do all of our good COVID mitigation measures like face coverings, like social distancing, good hand washing, and help us in the cycle of transmission. We're in a better place than we were 3 weeks ago, but we're far from where we want to be. Don?
Thank you, John. I did want to mention there was a slight delay before our program got started today, and that was due to a meeting that was occurring before this one. So our apologies for any delays or any confusion that may have caused. I will now turn it over to Mark Schulmeyer, Chief of Brevard County Fire Rescue, for an update. Mark.
Good afternoon. Mark Schulmeyer, Fire Rescue's Fire Chief. I like to start out every session by just letting everybody know the health of our organization. As of this morning, BCFR has 0 in quarantine and 3 in isolation, which is some of the lowest numbers we've seen so far this year and last year. We are seeing a steady decline in the number of transports of COVID positive and COVID symptomatic patients over the last couple of weeks, which is a trend we hope continues. We have gone from about 25 a day to less than 10 COVID positive or COVID symptomatic transports a day. Daily hospital wait times, which you've heard quite a bit over the past several months, has improved with fewer instances of ambulances and crews holding the walls of the hospitals. The majority of those wait times are in the 20-minute or less range. Some are in the hour range, and very few are in that 2 to 5 hour range. So a good news on that aspect. BCFR continues to work with our hospital partners on a daily basis to ensure that we are doing everything within reason to assist them with any capacity issues. We continue to ask people to only call 911 for emergent and life-threatening issues, and to please save the ambulances and ER trips for those that urgently need those services. But if you do call 911, we will always be there to respond. There have been no delays in Brevard County Fire Rescue getting EMTs or paramedics to the scene of the emergency during the pandemic. And as a shameless plug, Brevard County Fire Rescue is hiring. You can check out our job announcement on our website, on Facebook, Twitter, and other social media. So check us out. We are hiring EMTs, firefighter EMTs, firefighter paramedics, and paramedics. So thank you.
All right. Thank you, Mark. And I will now turn it over to Catherine Allen for an update from Brevard Public Schools. Catherine?
Thanks, Don. The schools, we don't have much to report. Again, we're seeing our cases and our quarantines trend down, just like we're seeing in the community. But I do think that it's important to keep in mind that on our dashboard today, there were just over 100 cases. That's the height of what it was back in, I think it was January, February. So we still have a high number happening in our schools, but we are pleased to see that going down. So we thank everybody for the part that they're playing in that. I too am going to give a shameless plug. We need bus drivers, we need substitute teachers, and we need food nutrition services people to help serve our students in the cafeteria. So just like a lot of businesses are being impacted, our schools too are being impacted by quarantines and other things. So if it's ever something you've considered helping out, we are also happy to just have volunteers. So you can check out more at our website. And that's all, Don.
All right. Thank you, Catherine. Seems like there's a lot of positive news today, but tainted with the fact that, again, as John said, we're still seeing 300 cases a day in the county, which is, very alarming in my opinion. I will now turn it over to Jesse Ray for questions. Jesse?
Thanks, Don. Okay, so we have a few from media. The first one is, what is your viewpoint on the recent drop in COVID-19 related hospitalizations locally? Is it a good sign of an improving situation, or does it mean, as Parish Medical Center says, that more people are dying in the hospital?
Well, certainly, I think that the hospitalization, again, it reflects the community in general. Same thing with schools. Schools reflect the community they're located in. We have seen a spike in deaths along with our spike in cases. I think that was to be expected somewhat. So the hospitals were, as you know, over the last few weeks, extremely stressed with their high admission rates. There were a lot of deaths in the hospital. Again, that continues in terms of they're certainly seeing high numbers still in their ICUs. Some of the vent numbers have increased in recent days. So, in terms of death, typically what you see with deaths as well as hospitalizations is about 2 weeks out from when we see a spike in cases, and is when that reflects in the general healthcare system. So I think it's starting to look like good news that their admission rates are decreasing.
Okay, thank you. Have you seen any impact in COVID-19 vaccination volume in Brevard related to the Biden administration announcement that employers of 100 or more people will be required to have all employees either vaccinated or tested for COVID-19?
No, I would have to say right now we haven't seen an impact on that. As I stated earlier, looking at this week, our daily numbers of folks seeking their first vaccine is down.
Okay. We did get a question about COVID-19 related deaths, but as far as I know, we do have a link for that, and we'll put that in the chat. And I think that's something that you can go and kind of find those numbers for yourselves. Are we seeing any staffing issues in our hospitals, and how is that affecting patients or surgeries or those kind of things?
I'll take that one. Yeah, we continue to see staffing issues across our hospital systems and really across our healthcare community at large. And it does absolutely impact patient care, a number of surgeries and those kinds of things. And it's just another complication, another problem, another challenge that our hospital systems and our healthcare community could continue to work to overcome.
Okay, thank you. So I was trying to understand a question. We got a question about, I think it has to do with our hospitalization numbers that we put out, the graphic that we put out as far as how many hospital beds are being utilized and how many of them are vaccinated versus those who are not fully vaccinated. And they're asking about why we're playing with numbers when bed counts can change with each report. I think there's a misunderstanding happening here. We're not, Dawn, you can help me with this. When we put out that graphic, we just get numbers from the hospital, and all we're asking for is how many patients in your hospital are hospitalized currently with COVID symptoms. And then we also ask if they're vaccinated or not.
Right. I do that as a weekly snapshot. So every Monday morning, I contact the communications officers with all 3 major hospital systems in Brevard County. And I simply ask them, how many people in your hospital currently are fully vaccinated versus not fully vaccinated? And to clarify that as well, not fully vaccinated, meaning they've either had 1 of 2 doses or they've had no doses of a vaccine. So, and they provide me those numbers, and that's all those numbers indicate. It's just fully vaccinated versus not fully vaccinated. And what we've seen on a week-to-week basis is that the number of not fully vaccinated people in the hospitals on Mondays overwhelmingly exceed the number of people that are hospitalized who have been fully vaccinated.
Right. So, Muriel, I hope that kind of answers your question. I think there's just some confusion happening there. So we talked about boosters earlier. When boosters are offered, are we going to need a doctor's note to be able to get that booster shot?
No. So I believe once, and again, I can't speak to what the recommendations will ultimately look like, but in general, that will be for folks that have not been identified as being eligible to receive the additional dose now. So likely that would mean the general public, and I would have to think that if that were the case, then no, there wouldn't be any kind of note required.
Okay, thank you.
I can also add to that,
Sure.
that currently, right now, those that are eligible to receive the 3rd dose, we are also not requiring a physician's note.
Okay, thank you. Okay, yes. So again, I'm going to revisit that hospitalization graphic that we post. Some people seem concerned that we don't revisit and talk about how many have recovered. I think it's been a little while since we've talked about why we don't have a recovered data. Could we go over that again just to re-clarify?
Yeah, we've talked about the recovery in many Facebook posts in the past. There's many different ways of reporting recovery data. So the state does not report the recovery data. Essentially, if you had COVID and you're 10 days out and you're doing okay, you're recovered. But the state does not report the recovery data. Every state is reporting recovery data in a different way. So it is just not a metric that is being captured.
All right, thank you, Maria.
Okay, thank you, Maria. And I think I had one last one. So the Biden administration has put out that it said any organizations with 100 or more employees. So is that including like 501(c)(3)s where it is an organization, but they're not technically employees, they're volunteers? Is that something that can be used to clarify? Can we clarify that?
Sure, I'll take a stab at that one. The short answer on that is when the president announced they were going to be coming out with that kind of rule and along those themes, obviously folks have a lot of questions. OSHA is supposed to be putting out a rule on that, which I think will provide a lot more clarity on what it is the federal government's intent to do and how that applies. So I know folks are anxious to see what happens there. We just ask for some patience and wait for OSHA to publicize their rule. which I believe they'll do sometime before October.
Okay, I think that's really all the questions that we can answer.
All right. Thank you, Jesse. I'm now going to turn the attention over to Public Safety Director Matt Wallace. Matt.
Thank you, John. And I'm really looking at our John and John experts here for to kind of answer this question, or at least give a little more clarity as the functional experts in this. There's a lot of discussion I've heard in the community about natural immunity, that, you know, a rising number of Delta cases plus our number of immunizations is making our community to a point where we reach herd immunity. And basically we're almost done with this pandemic because we have so much Delta infection. So could John or John, because you guys are way more experts at this and this, address that thought, or where those thoughts are going, and dispel any rumors and just kind of talk about that for a second, if you could.
So certainly those that are infected with the virus do develop some natural immunity. The thing about that is, though, that varies from person to person. So there's some people that may have a very high antibody titer from their infection, and there may be folks that have very little. With the vaccine, the protection you get is pretty even across the board in healthy adults. It does create a high titer. So again, kind of hard to know where each individual would stand based on if they were infected, how much protection they would have. Again, everybody's immune system is different. It is recommended that if somebody was infected with the virus, that they go ahead and get vaccinated. Certainly those folks, they're finding that had the infection and also got vaccinated are highly protected. They have a high antibody response. So that would be the recommendation. Now, if somebody does have COVID, it's recommended that if they seek vaccination, that they wait until they're out of the isolation period and have improved from their illness before seeking vaccination.
And if I could add to that as well, just to help, it's important too that we know that we deal with different variants. And so if you were impacted or you were infected with COVID and it was the Delta variant, we know there are going to be more variants. So as more variants come along, you're going to be just as vulnerable as you were the original time through. That's what we like vaccinations. Vaccinations have that sort of stronger, more universal protection against all variants, and are going to give you a higher level of protection going into that. So that's why you see the guidance coming from the CDC and the health department on why it's important that even though you've been impacted and you were infected with COVID, you still need to get vaccinated. It's going to give you a stronger protection.
You know, I'll also add and just say the statement that we're reaching herd immunity, we're nowhere close with the number of cases that we've been having per day. Running about 300 cases a day is still a very high level of transmission, extremely high level of transmission, even though we're getting better. So it is not showing that we have reached herd immunity.
All right. Thank you, Maria. Since we still have a couple minutes left in this program, and I'm trying to be thorough, we do have a couple more questions we're going to pose to our panel. Jesse, go ahead.
Yep, I did get one in our messages. So do you have any information from hospitals about their cases of COVID reinfection? They have had COVID once before and now they have it again. It would be interesting to see how natural immunity is holding up. Any takers?
I don't have those numbers from the hospital. We do see breakthrough cases. That is true. Basically, when a disease is reported, if that individual has been vaccinated and is registered in Florida shots, there is a mechanism to capture that. From what we're seeing with breakthrough cases of those that have been vaccinated, yes, we do see it. Thankfully, the numbers are low. We're talking about single digits, 2 to 3% at most. In terms of those that were infected before and not vaccinated, I don't have those numbers in front of me.
Okay, thank you. And I did get one other. How many COVID-19 related deaths have there been in kids 0 to 15 years old in Brevard County?
I'm not going to do a breakdown of ages. I would say that, again, you can seek the data on the CDC website, data.cdc.gov, and you can do a breakdown by county on that site.
Okay. And I can go ahead and I can post that. Sorry, I'm getting one last question, I believe. Any idea if Biden's monoclonal treatment cuts will impact Brevard County?
So I'll take that one. The short answer is we have no reason to believe that's going to be a thing right now. We continue to work very closely with the state of Florida and our federal friends to make sure we have enough to meet the demand here.
All right. Thank you, John. All right. So that concludes our program for this week. We will be back next Friday at 11:30. Thank you for joining us today.